Next at 10, health officials' goal is to get the vaccine to everyone, but data is showing some groups getting vaccinated more quickly than others.
Madeline O'Neill breaks down the disparities between races and ethnicities and what's being done to distribute the vaccine through a lens of equity. Maddie?
Well, the Department of Health Services is focusing on equity. For example, basing part of its vaccine allocation on the Social Vulnerability Index, and that helps them identify which communities have barriers to vaccine access, things like lack of transportation or technology. And now that about 20% of the state's population has received at least one dose, we are seeing some differences in which groups are getting the vaccine first.
Communities of color have been disproportionately affected by COVID-19.
State numbers show unevenness in vaccine distribution throughout Wisconsin, too.
We can expect disparities because there's a history of that, but we don't want to fall into that complacency.
Looking at just Dane County, about 24% of white residents have gotten at least one dose, compared to 10% of black people. Nearly 24% of non-Hispanic people have gotten at least one shot, compared to 10% of the Hispanic community.
It is our responsibility to help come up with solutions.
Vaccinators, including health systems, are coming up with their own equity strategies when both the lack of access and trust in healthcare play into it.
You have to get outside the four walls of the hospital and the clinics and really meet people where they are.
At SSM Health, part of that means open communication about the vaccine and partnering with community organizations that serve people of color and vulnerable populations, such as the Urban League. They can work with them to provide end-of-day doses to those who are eligible.
And if we can rebuild trust here, I honestly believe there's going to be long-term positive effect to overall better health for our community.
With increased options for vaccination, including the one-dose Johnson & Johnson shot, UW-Madison Associate Professor Ajay Sethi is hopeful we'll see some of the current disparities level out.
Now that we have vaccines that are going to be able to be delivered in doctors' offices and more widely, the excuses, there just aren't any excuses. We have to be able to vaccinate everybody.
DHS says they know there's plenty of systemic reasons for these disparities and acknowledge that historic racism within healthcare settings lead to some vaccine hesitancy. But as Sethi points out, latest survey data shows there's not too much of difference between races and ethnicities when it comes to the willingness to get a vaccine.